Hello, my name is Melanie Campos, and I'm going to talk about vitamin D supplements and prevention of cancer and cardiovascular disease. Definition: long prescribed to prevent and treat bone-related disorders, supplemental vitamin D has been viewed in recent years as a potential strategy for preventing cancer and cardiovascular disease. Ecologic studies have shown lower rates of death from cancer and cardiovascular disease if reduced with greater sun exposure than in areas with less sun exposure. Such exposure is necessary for cutaneous synthesis of vitamin D.
Hi everyone, this is Dr. Russo. Let's discuss if supplementing with vitamin D can decrease the incidence or your chances of cancer or cardiovascular disease. Now, we've all probably heard something about the health benefits of vitamin D supplementation, and there is evidence to support, yes, that supplementing with vitamin D can improve your health. However, it does appear that the health benefits of vitamin D supplementation have been over-exaggerated, and this study actually helps kind of reinforce that conclusion, which is essentially that vitamin D supplementation may not lead to all the benefits that you've been told that it will. Now, I'll put this study up here on the screen. This is a large study entitled Vitamin D Supplementation and Prevention of Cancer and Cardiovascular Disease. They tracked over 25,000 patients for a number of years looking at the incidence of cancers and cardiovascular disease over time in those supplementing with vitamin D compared to placebo. So this is a placebo-controlled trial. People were randomly assigned to either take vitamin D supplementation and tracked or placebo and tracked. So this is very high-quality data. It's not your typical kind of association or observational data, which we see in much of the vitamin D research. And their conclusion, to quote, supplementation with vitamin D did not result in a lower incidence of invasive cancer or cardiovascular events than placebo. So in summary, vitamin D supplementation does not appear to decrease cancers or cardiovascular disease. However, there is one important clarification I should make here, which is sun exposure has been very tightly, or I should say somewhat tightly correlated with reducing both cancers, most types of cancers, and cardiovascular disease. So sun exposure may vector the benefit that vitamin D has been purported to garner. So if you're trying to optimize your health, if you're trying to reduce or mitigate the risk of cardiovascular and or cancer incidence, then maintaining a healthy level of sun exposure is an excellent practice toward that endpoint. And I'll link here to a couple interviews we've conducted with vitamin D researchers that also provides guidelines, but essentially getting into the sun for at least 15 minutes a few days a week without protection is a great place to start. So 2 to 3 days per week, at least 15 minutes, middle of the day, direct sun exposure, no sunblock, exposing as much of your body as you can. The darker your skin is, the more exposure you may need. So that 15 minutes, that 10 to 15 minutes may need to be more.
Applications in medicine. Laboratory studies have shown the presence of vitamin D receptors in many tissues and have suggested possible vitamin D pathways that may be related to cancer and cardiovascular disease. An observational study have shown association between low serum level of 25 hydrogen vitamin D and increased risk of cancer and cardiovascular disease.
Vitamin D and omega-3 trial, VITAL, is a large-scale randomized clinical trial in primary prevention, a usual risk population of nearly 26,000 men and women nationwide in the United States, midlife and older ages. And its goal was to look at the effect of vitamin D supplements, 2,000 IUs a day, and omega-3, 1 gram a day, both the independent and the joint effects of these two interventions in preventing cardiovascular disease and cancer. So the major primary endpoint of the trial was combined cardiovascular events, which was heart attack, stroke, and cardiovascular mortality. And then we also had an interest in pre-specified secondary endpoints looking at heart attack and stroke and CVD mortality in an expanded composite. What we found, there are two main signals in the trial. Although there was no reduction in the primary endpoint of major cardiovascular events, we did see a significant reduction in heart attack, about 28% reduction in heart attack. And it was particularly in those who had low fish consumption.
At the end of the day, the results now reported show that vitamin D did not reduce the risk of cancer and did not reduce the risk of heart disease. So that, as many of us feared, this cult of vitamin D use turned out not to be an effective approach to preventing disease. And it's a warning that this widespread use of dietary supplements without good scientific evidence can lead us to make mistakes.
With vitamin D, we saw a signal for a reduction.
Pros and cons. It is uncertain whether supplementation with vitamin D prevents cancer or cardiovascular disease because such results cannot establish causality. For example, observational studies are susceptible for confusing outdoor physical activity, which correlates with sun exposure, adiposity, which may decrease viability of 25 drugs, vitamin D, mineral nutritional status, and other factors that may produce superficial protective associations.
One of the topics we seem to have covered the most here on Healthcare Triage is vitamin D. And for the most part, we've been telling you most people won't benefit from supplementation. Today will be no different. This is Healthcare Triage News. Why is this news? There's a new study out. To the research. Big meta-analysis published very recently in JAMA Cardiology. They searched all the usual databases for randomized controlled trials of vitamin D supplementation to reduce cardiovascular events like heart attacks or stroke or all-cause mortality. To be included, studies had to look at long-term effects, at least 1 year, of supplementation. The main outcome of interest was a major cardiovascular event. They also looked at rates of myocardial infarction, stroke, or cerebrovascular accident, cardiovascular disease mortality, and all-cause mortality. They found 21 randomized controlled trials. They included more than 83,000 patients, half of whom got vitamin D and half of whom got placebos. The average age of participants was just over 65 years, and about 3/4 of them were women. And the results? Prepare for disappointment. Vitamin D had pretty much no effect on the rate of cardiovascular events. Seriously, the relative risk was 1.00.
Issue applied in Ecuador. Data from large-scale randomized trials involving more than 10,000 participants of vitamin D moderate or high doses of diagnosis with cancer or cardiovascular disease as primary outcomes are lacking. Trials examining such outcomes, typically using secondary or post-hoc analysis, have usually shown nil results, but the use of low doses of vitamin D is with statistical power, short duration, lack of rigorous endpoint identification of a combination of these factors limit conclusions.
Big headline about health from a study of almost 1 million people. Today, a new report says you can cut your risk of cancer and heart disease by paying closer attention to a vitamin D. Here's ABC's Maros Galvacampo.
It's a spring ritual, getting reacquainted with the sun, and a critical one, too. The major new study of nearly 1 million people finds the lower your vitamin D levels, the higher your risk for certain diseases. including a 35% increased risk of death from heart disease and a 14% increase in death from cancer. Vitamin D not only helps block a host of major illnesses, it can boost your heart and even strengthen your bones. This while an estimated 2/3 of the population isn't getting enough.
So just how do you raise your vitamin D levels? Well, for one thing, spend more time outdoors. Doctors recommend about 1 hour of time in the sun per week, and they say to expose as much skin as possible. Of course, experts say you have to take precautions.
In conclusion, supplementation with vitamin D did not result in a lower incidence of invasive cancer or cardiovascular events on placebo.
What's the deal with vitamin D and the prevention of breast cancer? Dr. Suva, great to have you here.
Thank you very much.
A lot of information in the lay press about vitamin D. A lot out there. You're an expert in this. What can we share with our viewers about vitamin D and the prevention, perhaps, of breast cancer and other cancers? We need your insights on this.
Oh, wow. Well, I'm delighted to be here. I'd be happy to share what I know. Certainly, there's a lot of information in the press. Some of it good, some of it bad. Like everything in the press, you can't always believe what you read in the New York Times or the Arkansas Democrat Gazette, where we're currently working. But for sure, we have to understand that we need to measure vitamin patients with all situations, clinical situations, cancers, breast cancer. We need to have an accurate measurement of their vitamin D baseline. We call it the level at the start of whatever supplementation they might need.
Larry, should that be something that the primary care doctor should be doing?
Yes, I absolutely believe that's where that should start, for sure. It's inexpensive. Medicare pays in most places. It's a standard assay. There's a couple of places that do it
So
nationally.
like we check our cholesterol levels and
Yes,
things like this.
that would-
Your
yes.
vitamin D should be one of the things we
Yes,
should check
yeah.
and know about ourselves.
Yes, we should all know our vitamin D. Do you know your vitamin D level?
I do.
Okay,
and
me
it's
too.
low, and I'm actually on vitamin D
Indeed.
supplements.
Good for you. Mine's in the low 30s, and I supplement in Arkansas. I supplement in the winter months.
Okay. But tell us more, though, about your thoughts about if we have normal levels, is that preventative for cancers?
I don't think we know if it's preventative for cancers, but for